What about now?
Just can see you.
Oh, there I am. Hello, everyone. I apologize for that. My name is Sister Ebonee Stevenson. I am going to be your lecturer for today. Since, for those of you who don't know, every year in Toma, we observe May as being our health month. And we typically use the month of May to talk about different health related topics concerning the Black community. I know we've covered mental health and violence and stuff this month. And so today is the last Sunday of the month. So I'm going to close out our health month with the topic that's very near and dear to me. And that topic is Black women and fibroids. I'm only going to be able to touch on a bit of information during this next 30 minutes or so, but my contact info will be on my last slide. So if you would like more information about this topic or any of the other health issues that we talked about this month, please always feel free to contact us at 312-505-2829. And you're always welcome to join us on Sundays at our headquarters at 616 East 71st Street, Chicago, Illinois, 60619, in the Grand Crossing community of Chicago, Illinois. And so I am going to ask Minister Amari to start my slides. Okay, next slide. Okay, so this is a very interesting statistic. And I've done this presentation before, but just each time that I look at it, it's something, fibroids affect so many Black women, so many Black households. And typically among Black women, when you talk about health issues, we'll talk about breast cancer, we'll talk about uterine cancer, but we don't really talk about fibroids. So, excuse me, this statistic is by the age of 35, 60% of Black women will suffer from fibroids. More than half of Black women by the age of 35 will have had at least one fibroid. Now, why isn't this something that's taught to us in health class when we're in high school? Why isn't this something that, when you go and get your checkup at the doctor, that they don't ask you about fibroid history in your family or if you've ever experienced fibroids? Because for some people, fibroids can be something that, is not painful, that, it just exists. But then for some women, fibroids can really impact, their day-to-day life to the point where, some women can become incapacitated due to fibroids and have to have surgery because they can be really painful. But if there was so let's say if we said, oh, by the age of 35, 60% of Black women will suffer from breast cancer, they will be setting off the alarms, right? But it's interesting that no one is setting off the alarms about fibroids, and fibroids is really the thing that can impact a Black woman's fertility. Next slide. That's a video. Can you play that?
Sorry, you put it into the. Hold on. Let me see. Sorry, it wasn't sent as a video. It was just sent as a slide.
Oh, okay. Then you can go to the next slide. So the reason why I said that fibroids is something that's near and dear to me is because I have experienced them myself. And because I didn't know what a fibroid was, and so for those of you who don't know, fibroids are benign tumors that can attach themselves to your uterus. That's what they're called, uterine fibroids. It's typically the term that you'll see. And they're benign, meaning they're non-cancerous. So they're gross, that are attached to your uterus, but they are benign. So I actually suffered from this in my mid 20s, and so this is my story. And then once again, if this lecture relates to you and you want more information, always feel free to give us a call or check us out on a Sunday at 616 East 71st Street, and we can talk with you about this more in detail. So next slide, please, Minister Omari. So I had a fibroid that I affectionately named Tallulah. Now, the reason I named my fibroid is because I had to be in OB and gynecology when I got my surgery. And I was surrounded by like all of these pregnant women. And so I was the only one in there who was not pregnant. And so because my fibroid was larger than the size of most large babies, I affectionately named her Tallulah. So my fibroid, Tallulah, was over 15 pounds. Can you imagine carrying around a 15-pound baby inside your body and the strain that will have on you, pulling on your spine, and that it's attached to your uterus, by the way. It was the size of a basketball. So just imagine you just got a basketball just floating around in your abdomen. It was so large that the fibroid pressed against my organs, including my kidneys, which was giving me issues with going to the bathroom. And that something that was unique about my fibroid was that it was one solid mass. Now, see, a lot of women, when they get smaller fibroids, sometimes they'll have one or two or three, and they're like little tiny fibroids, or they can be a little bit bigger, like golf ball size, or even bigger than that. But they'll have a couple of fibroids, a couple of growths. But mine was one solid mass. Next slide, please.
I can show that video if you like, or you want to come back to it.
Yes, if you can show the video, that would be great.
I was diagnosed with fibroids around the summer of 2015. I got diagnosed with an autoimmune condition, and then maybe a few months later, I got diagnosed with fibroids. I had 2 small ones. I knew something that may have been wrong because I was having heavy periods for a while, but I just, I didn't think it was a big deal. So when I was initially diagnosed with fibroids, they were 2 small fibroids, and then they kind of morphed into one larger one over time because it just started to grow and get bigger. So it's becoming a bit of an issue, especially because I would like to have kids in the next couple of years. But then I also read stuff online where women are like, oh, my fibroid was 15 centimeters and I had a healthy baby. And then I went vegan and my health improved dramatically. When I went to get testing again, then I had low iron. It's just it was never ending. When I went to this outdoor fair this year of 2019 in Brooklyn, there was this Black woman there. She was a tea practitioner, I guess. She had various herbal concoctions for different conditions, one of them being fibroids. And she told me to keep drinking it. I felt fine, who knows if it was working, but she did say that a lot of her patients have seen a reduction in their fibroid tumors and have had easier pregnancies. But the reality is I have to put my health first. So I think that, I can't just do this by myself, and I have to get to a point where I get support. So that's something that I definitely want to address by the end of this year, finding a way to get support so that I can maintain veganism or at least some sort of plant-based diet, because I felt so much better and my periods were better. And like I said, I really do believe that they've gotten smaller once I was vegan.
Hi, I'm Dr. Naika Pickering. Today we're going to be talking about natural remedies for fibroid management. Black women tend to suffer from fibroids a ton in society. It's something that's really prevalent, and I see it in the office all the time. When I'm managing a fibroid case, I like to make sure that you're getting really comprehensive care. So the first thing I like to make sure you have is actually a gynecologist, somebody who could order imaging and do the lab work. And then from my perspective, I will treat from a more holistic lens to help you feeling better, because you don't have to suffer with fibroids. There is a way to manage it. When we're in the treatment phase, we tend to be more aggressive. We really want to get your body to a state of balance. We really want to flood your system with an abundance of nutrients. So whether it be nutrients or herbs, that's how we target treatments. Once we get you to a place where you're more steady and you're starting to feel better, you know, your symptoms are reducing and you're feeling more vital, we tweak the treatment a little bit to be more conducive to your everyday lifestyle. So you won't have to take as many supplements or make as many changes. You're sort of cruising. Yeah. I like to focus on diet a lot, because we know that inflammation is really something that helps fibroids grow. So we want to tone that down a lot. So we could work on getting you into more of a plant-based lifestyle. I like to reach for more of a pesco vegan diet. So that looks like eating a ton of fish and vegetables and fruit, and kind of lowering the grains and the sugar, even though that's hard because it tastes really good. But fibroids tend to grow when there's more inflammation in the body. So that's more of the diet side. My clinical interests have always included hormonal health. It wasn't until I opened my practice last year that I kind of tailored my specialty to what was being presented in front of me. So I was presented with a lot of Black women coming in for women's health issues, especially infertility and fibroids. As I delved more into those cases, I got more comfortable with treating them, and then people would refer out and then bring more people in for infertility and fibroids and other women's health issues. So in that way, that's how it became my specialty.
Thank you. The reason why I wanted to share that video is because, and we'll get into this a little bit more, something that was interesting, that the sister who had the fibroids, that she talked about was fertility. And when we talk about, you know, fertility issues among Black women, we really don't have conversations about fibroids in our community and how fibroids can impact your fertility no matter how old you are. And so it's very important that, like, if this issue runs in your family, like if you talk to your mom, your aunties, or your grandmas, and they're like, oh yeah, we have fibroids, oh yeah, I had a fibroid, then there's a good chance that you'll have fibroids too. And so that's something to be on the lookout for. And then also, what was very important was the doctor that spoke, who was a Black woman. Do you notice how she talked about all of these holistic treatments and diets, and like that was her treatment to getting to reduce the fibroids, and then also increasing the comfort of the Black women experiencing fibroids. Now, what's interesting is that she is a unicorn in the health industry, because most times when Black women go to seek treatment about fibroids, surgery is usually something that's offered to them. And if you notice, nowhere in her presentation, when she talked about how she treats women with fibroids, did she mention the H word, hysterectomy. And we're going to get into that a little bit later in my lecture. But if you don't know, Black women are offered hysterectomies at higher rates than white women. And it's interesting when we talk about the disparities in the healthcare industry and how they treat Black people. For example, thinking that Black people, well, not thinking, but pretending that Black people have higher pain thresholds, so they don't give us as much pain medicine as they do our non-Black counterparts. This is something that's very important, because when you look at women, Black women in childbearing age, and they're getting these hysterectomies, that's really cutting off the amount of Black children that are being born. Now, if I said that by the age 35, 60% of Black women will experience fibroids, and we don't know what that number it is of how many of those women who have those fibroids is impacting their fertility. And so because fibroids can have a direct impact on the fertility of Black women, that's a direct linkage to the birth of Black babies. And so it's interesting that in the healthcare industry, instead of trying to treat the fibroid, that a lot of these doctors, particularly these white doctors and these Indian doctors, try to remove their uterus. And so that's just something that, you know, that you should be on the lookout. I always tell Black women, if you have fibroids and you go to the doctor and the first thing out that doctor's mouth is hysterectomy, you need to get a second or a third opinion, because that should not be the first solution to your issue. Minister Martin, next slide, please. The next one. There's also another video in the slide, Minister Martin. I don't know if you can get that one queued up for when it's time to play. But yes,
ma'am.
So when I talk about fibroids, I always feel like it's just like when you're in church and you're giving a testimonial about how God has impacted your life, or the Creator, or Allah, or whatever name you call the divine essence that created all of us. Now, this photo right here isn't a stock photo off of Google or anything. This photo is actually a photo of my fibroid when they were removing it from my body. That little brown skin that you see, that's my abdomen. And so when I know we're visual people, and I'm not ashamed to share these photos, because I would always want, you know, my story to be an example for other Black women to not do what I did. And I'll go into that. So when I said that my fibroid was one solid mass, as you can see, that was one solid mass. And it was the size of a basketball. And what was I'm a nerd too. I'm a science nerd. So what was also crazy about my fibroid that you'll notice on these photos is that it had its own veins. So if you look very closely at the photo, you'll see the veins and things like that. And this is just one mass of tissue. Next slide, Minister Omari. This is another photo. So the reason how I knew that I had the fibroid was that I was coming home from work one day. I had a good day at work. One of my coworkers was dropping me off. I was chilling in the car, listening to some Metallica, getting ready to get out of the car. And then all of a sudden, I was hit with the most intense pain. Now, I've never experienced childbirth, but when I say that pain was so intense, like someone was carving up my insides, that's how intense the pain was. I was in so much pain. My friend dropped me off at the University of Chicago emergency room. And I was in so much pain, I was curled up in a wheelchair, bawling my eyes out, crying for my mother. Now, for context, I'm not someone who cries easily. I'll cry at funerals, and maybe, you know, while I'm watching one of my favorite K-dramas, some like romantic story, I'll cry for that. But I'm not like a crier. And so the fact that like I was bawling my eyes out, crying for my mother, gives you an example of how intense and crazy that pain was. Next slide. And this is just one of the last slides that you can really see up close the vein system that had developed in this tumor. Remember, fibroids are benign tumors. So this large excess 15-pound growth was just one solid ball of flesh. I'm sorry if I'm being a little graphic with these photos, but I feel like the story is really good to share. And like, if you have Black women in your family, you can definitely share this story with them, because this is definitely something that we do need to know. Next slide. And so this photo is actually the photo of my fibroid removed. Even when I look at it to this day, it is insane that this giant ball of flesh was just living inside of me. I was feeding the nutrients, like when the doctor said, you know, cutting down on the starches and things like that. And it was eating so good inside of my body that it grew to this size. And so this is just a warning sign that, like, if you, and something that was unique about my situation was I didn't have any pain before that day. I wasn't really having heavy periods. My periods were super normal, as they normally were. And so I didn't realize that I had this growth until I went to the emergency room. Next slide, Minister Omar. So, are you able to play that video, Minister Omar?
I am Dr. Arabia Molet, and today we are going to talk about uterine fibroids. Uterine fibroids are the most common, solid, non-cancerous pelvic tumors in women. And fibroids tend to shrink after menopause due to a decrease in hormone production. At least 80% of African American women had developed a fibroid. Black women are more likely to develop fibroids at an earlier age than any other racial group in this country. And we are also likely to develop larger fibroids, which can severely impair our quality of life. So signs are back pain, leg pain, bloating, weight gain, heavy prolonged menstrual bleeding, frequent urination, constipation, and/or fertility issues. Fibroids can be asymptomatic, where some women, they don't have any abdominal pain, they don't have any bloating, they don't have frequent urination or constipation. But then when it becomes symptomatic, that's when it becomes a big issue, because now you're dealing with anemia, which is your low hemoglobin level. You're dealing with headaches, you can have chest pain, and also fertility issues. So the best treatment as far as uterine fibroids, it all depends on where the fibroids are, how big they are as well. Most OBGYNs will treat the signs and symptoms first by birth control to control the bleeding, and also giving pain medications such as naproxen, ibuprofen, to be able to have better pain control. If the women are symptomatic, then there's talks of a myomectomy, which is the removal of a fibroid, especially if the woman wants to preserve her uterus for pregnancy. The best thing is, again, weight management. I mean, when you speak with your OBGYN doctor, that there's a family history of women in your family that suffered from fibroids. So that way that could be monitored early. And then when you get your yearly exam, that's something that they will take into consideration. So again, it's just a matter of ownership of your health, making your health as a priority, and following up with your yearly appointments with your OBGYN doc before you see me in the emergency department for prolonged vaginal bleeding and anemia.
Now, something that was unique about the difference between those two doctors. Now, you notice that for her, the first thing that she recommended, or that she was saying our doctors would recommend, was prescription drugs, right? Or pharmaceutical drugs. And then she talked about like myomectomies, right? Or hysterectomy surgery, right? And so just think about how those two doctors had two different treatment that they recommended. And so this is why it's very important to get a second opinion, no matter what the race of your doctor is, because you never want to get into a situation where you're getting unnecessary surgery, that if more holistic methods are available, that you can take advantage of that. So next slide, Minister. And I know I'm running out of time, so I'm going to go through these next slides. But like I said, if you would like more information about this topic, like if you want us to come talk about this at like your church or your school, or you want to come visit with us in person and talk with us one-on-one, you can always reach out to us at 312-505-2829. You can shoot us a message on Facebook. Our Facebook is Toma Nation. And then also you can contact us at our headquarters, which is 616 East 71st Street in Chicago, Illinois. So fibroids, non-cancerous growth in the uterus, Most common pelvic tumor in women. They range in size from being seedlings, which are undetectable, to the human eye, to bulky masses like the one I had that can distort and enlarge the uterus. They are a major reason women undergo myomectomies and hysterectomies. Next slide. Cause. Doctors don't know the cause of fibroids, but research and clinical experience point to these risk factors. Race. Black women are 3 times more likely to have fibroids. Heredity. Like this is what I said, if your mother or sister had fibroids, you're at an increased risk of developing them. Other risk factors, obesity, which was one of my issues, early onset menstruation, vitamin D deficiency, diets high in red meat and alcohol. Next slide, Minister Omari. Black women. Like I said, Black women are 2 to 3 times more likely than white women to have fibroids. And this is what the statistic that she said. So remember in the beginning when I said 60% of Black women by the age of 35 have fibroids. That's just by the age of 35. Now, after that, during the life cycle of Black women, 80% of Black women have had fibroids. Fibroids in Black women often occur at a younger age than white women, and fibroids in Black women tend to be more severe than their white counterparts. And so you have some women, and they'll talk about how they have really painful periods, really painful menstruation, but no one is asking them, do fibroids run in your family? Have you ever asked your OB/GYN or your gynecologist to check you for fibroids, especially if you're trying to get pregnant? This is also something that you definitely should find out about. Next slide. 25% of Black women will suffer fibroids by age of 25. Remember, we said 60% will suffer fibroids by the age of 35, but 20% of Black women will suffer fibroids by the age of 25, and 80% by the age of 50. Black women are 2 to 3 times more likely to undergo surgery. And this is something that I was just talking about. 40% of Black women with fibroids report painful menstruation and cramps. Black women are 3 times more likely to suffer anemia due to fibroids. You know, we have a lot of us out here who are anemic, right? And so the doctor's giving us iron pills and these other things, but they're not addressing where the anemia is coming from. And so this is why it's very important that you do have those regular annual checkups with your gynecologist or your OB/GYN if you're looking to get pregnant or are pregnant. Can you go to the next slide, please, Minister Omari? Now, this is interesting. More often, Black women with fibroids report symptoms that interfere with physical activity, so exercising. Black women also experience severe symptoms that impact personal relationships and sex lives. And this is something that I said before. Black women have more difficulty retaining fertility, those who have fibroids. Next slide, Minister Omari. Once again, the symptoms: heavy and prolonged menstruation, anemia, which can lead to fatigue. We have a lot of sisters out here who walking around here and they're always tired and they don't know why they're always tired. They're taking multivitamins, they're taking iron, they're eating leafy greens, you know, and there's no reason why they should have this fatigue. But once again, it's not standard for doctors to ask you about whether or not fibroids run in your family. I've never had a checkup where the gynecologist asked me, did I have a history of fibroids? Fibroids can cause pain during intercourse, frequent urination, constipation and or bloating, pain in the pelvis or lower back, increased cramping, protruding belly, or they could be asymptomatic like I was, where you don't have any symptoms. Next slide. Pregnancy. Fibroids usually don't interfere with getting pregnant, but they can contribute to infertility, pregnancy loss, placental abruption, fetal growth restriction, and preterm delivery. Next slide. 1 in 5 women believes that hysterectomy is the only fibroid treatment available. Now, this is what I said, and I want to read this that I pulled up. Now, so because nearly a quarter of Black women between 18 and 30 have fibroids compared to about 6% of white women. Now, there are disparities among these two populations. The reason for the disparities are unclear, but they are still doing research. Fibroids have been associated with potential risk factors, including starting periods at a younger age. Now, Black women are also at least twice as likely as white women to remove their uterus through a hysterectomy. A third of hysterectomies are done between peak childbearing years between the ages of 18 and 44. Now, why is it that Black women between the ages of 18 and 44 are being offered hysterectomies without being offered any other alternatives. Like the first doctor, she talked about all these holistic approaches about changing your diet and doing these other things. And so once again, please always make sure that you get a second opinion. And I know my time is at hand. So once again, like I said, this is a PowerPoint presentation. I can share this with you and your organization. If this is something you would like to present to your membership, like all of the churches and schools and universities, we need to be talking to Black women about this, because something that impacts our fertility is something that we all should know about. So my time is at hand. I want to thank you all for joining us live here at the Toma Nation. And if you would like more information, feel free to reach out to us at 312-505-2829, or always feel free to give us a call, slide through to our edifice at 616 East 71st Street in the Grand Crossing community of Chicago, Illinois. Peace and blessings, Black family. For joining us for our weekly Sunday worship service. We invite you and your family to join us live every Sunday at 616 East 71st Street at our new time from 12:30 to 1:30 p.m. and on Facebook from 12:30 to 1 p.m. If you have enjoyed what you have heard, please feel free to support us with a monetary gift on Cash App at $TOMANATION. Once again, that's $TOMANATION. This will conclude our live stream. The message you have been listening to will continue live here at the Toma headquarters. We thank you, Black family. See you next Sunday. Black Power.
This is the eternal divine spirit, the one that causes all that exists to exist, the one that is self-existent.
How many men have children and the children never meet their father? See, you created a void in that child because you are a part of that child.
Black power! Black power! Black power! Black power! Black power!